So hello and welcome. We will start today without any further delay. Okay, welcome Komal. Uh, uh, Welcome Sunil. Since last 2 days we are regularly sharing the videos, but I today I decided even if no one is there, I will record the class and just upload this fresh one. Okay, in the recorded video, something at some places what I am want to share is at some places missed. So I decided to record it today. Up to in those recorded classes, we have covered up to aphorism number 73. Okay, this 74, 75, and 76 dealing with the artificial diseases. Okay, we have already told that these artificial diseases may be due to homeopathic employment of medicine in large doses and in repeated form. Okay, so you will get homeopathic artificial diseases also, and also you will get most intensely you will get these artificial diseases due to allopathic employment of diseases. We have discussed the China malady, we have discussed the mercurial disease, masked venereal disease, and we have discussed and we have told about that steroidal diseases due to steroid, diseases due to aspirin. Okay, diseases due to prolonged use of certain antibiotic. All these are artificial chronic diseases. Okay. So these artificial chronic diseases, Hahnemann have already told that these are the diseases which are difficult to cure. We have discussed the difficult and incurable cases. So in difficult, wait a second. In difficult diseases, comes the alternating diseases. Go to Kent's last lecture, you will find that one-sided diseases, alternating diseases, these are difficult diseases where there are less scarcity of symptoms. There are scarcity of symptoms. These are the diseases which are difficult to cure, and this is artificial diseases are also one of the difficult disease to cure or sometimes incurable. Okay, and how to cure it, Hahnemann have mentioned it. Sometimes incurable. You see that Herring was unable to wear the tie due to proving of lachesis. Why it was? It was due to artificial disease of lachesis. You will get in Kent's lecture a mention of lachesis where he encountered a patient who was suffering from lachesis artificial disease. Okay, so this artificial diseases may be formed due to homeopathic employment, maybe due to allopathic employment. Most often you will find this in allopathic setup. Okay, there is a book, I will refer it to you for those artificial diseases, artificial chronic diseases. Okay, there is a book by Pharmacology and some specific works, Hazards of Medicine by Thomas Zaz. Hazards of Medicine. You can write it down. If you get the PDF, it's okay. You can buy it also. Very good book. Hazards of Medicine, for in-depth study of this artificial diseases. Hazards of Medicine by Thomas Zaz. S is silent. Thomas Zaz. Hazards of Medicine. If I get a PDF, I will share it to you. Okay, and these artificial diseases are nowadays more prevalent. You will get in HRTs. Okay, in not needed, even they are giving HRTs. Okay, in the menopausal women, you will see if they are complaining of some sort of joint pain, they will think that this is due to steroid, due to less production of estrogen. So they will add on estrogen. So you will get in menopausal woman, if a menopausal woman goes to allopathic physician, they will start HRT, hormone replacement therapy. They don't know that nature don't need it. That's why it is automatically going down. They don't know that, they don't think in this fashion. Okay, and this HRT is going to produce an artificial disease due to hormone imbalance. What was not needed, you have feeded it. Okay, same thing is happening with vitamin D. there is a vitamin D epidemic sort of thing that people are using at rampant vitamin D. Why they are using? They only can tell. Okay, because the tests are vitamin D tests are very expensive, so they can get some. So they can get some commission from the lab. Okay, vitamin D pharmacology companies are promoting it. So every now and then you will see that they are prescribing vitamin D, and this vitamin D patients are taking for years together. What it will do? This will create a vitamin D toxicity, and this is one of the artificial disease. How to encounter this? Hahnemann has said there is no way to encounter it except this only can do. Okay, the nature, the vital force only can do. Same thing has happened with the vaccines. Okay, too much vaccination is producing vaccine. I have shared 2 books. Just look on those 2 books will reveal that how dangerous this vaccination have been. Abuse, not the use. Okay, be sure to advise in cases of vitamin D that lab will say less than 25 nanogram per deciliter is is a scarcity or the deficiency of vitamin D. But be sure, until and unless it is less than 20, you don't need even the supplements, nutritional supplement. Even if it is between 15 to 20 or 10 to 15, that can be well managed with nutritional supplement. Okay, vitamin D are present in some food item. You can ask your patient to take them. Ask your patient to walk in the sun. Sun is the best source of vitamin D. Okay, and there are nutritions. There are milk available. There are bread available. Those which are fortified with vitamin D. Okay, so less than 10 vitamin D supplement, actual supplement of vitamin D is needed. Same thing where there is no need, statin where there is no need and they are giving. Okay, that was not happening during the time of Hahnemann. They were thinking that it is needed, that this they will give. Okay, but nowadays in modern medicine they are giving all together for the precautionary purpose. I don't know for what. Okay, many diseases you will encounter. Okay, and most common of them all are OCPs. Okay, that also causing the these OCPs are also causing this artificial disease. Okay, ask your patient that in female during the history taking we give special importance to pregnancy, to menstrual irregularities, to any other discharges. To when you are taking the history of pregnancy, ask your patient that what you do usually do to not take the child. Okay, they will say that I am taking OCP. For how long you are taking? They will tell that I am taking it for 10 years and 20 years. Okay, for 5 years, for 15 years, like that. You will get these patients in NIH OPD. Okay, coming from the villages and taking the these hormonal pills. So how to treat them? There is no way to treat them. Okay, but Hahnemann is saying, but nowadays there are medicine available. We have told that hormones, for hormonal pills, bad effect of hormonal pills, we have medicines Adcortex, we have medicine thyroidinum. Okay, we are giving medicine according to tautopathic. Okay, aspirin was abused, penicillin was abused, insulin was abused. We are giving these medicines in potentized form. Okay, so these are nothing but the white collar crime. Okay, in that book which I have referred, Hazards of Medicine, they are telling it white collar crime. Okay, artificial diseases, iatrogenic diseases produced by medicine, produced by treatment. Okay, so this artificial disease we will read in this a group of these aphorisms is a group of 3 aphorisms. Okay, after that a single standalone aphorism is there which is dealing with the artificial pseudochronic disease. The better name for which Hahnemann is giving is inappropriately named chronic disease. These chronic diseases are occurring due to accessory circumstances which patient can avoid themselves. Okay, this is stand-alone aphorism 77 dealing with the inappropriately named chronic disease. After that, the natural chronic disease have been discussed. We are dealing with the general knowledge of diseases. Okay, knowledge of diseases in general. Okay, and this is general survey of disease 78, 79. Natural, true natural chronic diseases up to 8. From 83 onward, 4 is dealing with the knowledge of disease in particular. Okay, so we are at aphorism number 74, which is dealing with the artificial chronic disease. Aphorism 74, 75, 76. These are the group of 3 aphorisms you will encounter in Organon of Medicine. There are groups of aphorism, there are standalone aphorism, there are bhumika aphorisms, there are punching aphorisms. Okay, like this, and these aphorisms have been blended into chain. So these three aphorisms, we are having 74, 75 and 76. So can you read 74, aphorism number 74?
Among chronic diseases, we must still, alas, reckon those so commonly met with artificially produced in allopathic treatment by the prolonged use of violent heroic medicine in large and increasing doses, by the abuse of
Underline this.
calomel, corrosive,
Underline this. Prolonged, underline prolonged, violent, heroic, large and increasing quantity. If it was not violent, if it was not heroic, what would happen? What would have been happen? This was mild allopathic treatment. Okay, aphorism number 37. Mild allopathic treatment have no effect on the chronic disease, natural chronic disease. Okay, but it is violent. You have to mention the word violent, heroic, large, increasing doses, repeated doses. Same thing is happening with the homeopathy. Okay, if you are giving large doses, recurrent, increasing, repeating, then it will create a pathology. It will create artificial disease. Okay, so underline prolonged. एक दो बार खाने से कुछ नहीं होता. Prolonged, violent, underline large, underline increasing. Okay, by the abuse of calmol, corrosive sublimate, mercurial ointment, these are not being used nowadays, but mercurial ointment are being used. Chavanprash, what is that? That is mercurial preparation. There is shuddhikaran of that para in Ayurvedic and Unani medicine. They will tell that I am purifying this mercury and making our medicine with this. Chavanprash, Majun, all these are containing mercury to some extent. Okay, so mercurial, that lal dawa, red ointment for injury, any kind of injury. What are these? These are mercurial preparation. They are a mercurial ointment also used. Mercury are being used in ointment. So these are being used nowadays also. But some of them, like nitrate of sulfur, is also being used nowadays for burning, treating the burn. Iodine and its ointment are being used. Okay, quinine are being used, digitalis are being used, foxglove, and some medicines are obsolete in modern medicines. Some medicines are still being used, and these have been replaced by antibiotics, by hormones, by vitamins. All these are, you can replace the name. Just and now read next. Whereby the vital force, from here, leave those names. Okay, whereby the vital force, you can add present day medicines and drug here. Okay, and next read from here. Whereby the vital force,
whereby the vital force is sometimes weakened to an unmerciful extent, sometimes if it do not succumb, gradually abnormally diminished by each substance in a peculiar manner, in such a way that in order to maintain life against these inimical and destructive attacks, it must produce a revolution in the organism and either deprive some part of its irritability and sensibility or exalt these to an excessive degree, cause dilatation or contraction, relaxation or induration, or even total destruction of certain parts, and develop faulty organic alterations here and there in the interior of, or the exterior, cripple the body internally or externally, in order to preserve the organism from complete destruction of life by ever renewed hostile assault of such destructive forces.
Okay, now underline, in order to maintain life against this inimical destructive attack, it must produce a revolution in the organism. In order for what? Vital force has to preserve the life. So this is being taken again and again and again and again. Vital force have to preserve the life to such an attack. So it will produce some revolution. Okay, some part, sacrifice of some part. Okay, आंख चला गया, नाक चला गया, कान का, जैसे ये बार बार जो हम लोग ड्रॉप डालते हैं, ऑट्रोपिन ड्रैग, ऑट्रोपिन ड्रॉप, what will happen? Anosmia will create it, atrophic rhinitis will be created. Okay, how? No, deprived the function of its part. Why vital force is doing this? Vital force is unintelligent. It have to protect itself from the assaults, these assaults. Okay, convulsion, anti-convulsive medicine, what it is doing, it is making dull, it is depriving the nervous organ of its functions. Okay, so these are the revolution vital force have to produce. What sort of revolutions are these? Deprive some part of irritability, sensibility, okay, or exalt these an excessive degree. Function खत्म हो गया या function बहुत ज्यादा हो गया. Okay, dilatation, contraction, all these, even total destruction of the part, all this for what? For preserving the life. Okay, and all this happening, why? This is happening due to these external inimical forces which have been applied, strong heroic medicines which are being given. Okay, underline this. In order to maintain life against these inimical destructive attacks, it must produce a revolution. What kind of revolution it is? It will either deprive the function or exalt the function, or total destruction will be there. Why this has been there? Due to this vital force have to preserve its life. Okay, and you will get a long footnote regarding Brosser treatment. Brosser treatment we have discussed before also. You will get in the 6th edition these footnotes, because the Brosser was a physician living in the Paris, practicing in the Paris, and he was the physician who advocated advocated this bloodletting and all this. Okay, so later on he reformed under influence of Hahnemann. So if the 7th edition of the Organon would have been there, you will find these footnotes would have been removed from the 7th edition, because Brosseau have been reformed himself out of these practices. What was his practice? Bloodletting, leechings, and hunger diets. All these were his practice. Okay, you will find long footnote in the introduction of the 6th edition, Organon of Medicine, 5th edition, because this edition was prepared in Paris, and Brosseau was a Parisian physician practicing there and advocating these sort of rules. Okay, but he was reformed. He reformed himself under the influence of Hahnemann later on. Okay, so these are quite just for academic importance. They will ask you these questions in the examination. What is Brosseau? Who was Brosseau? What was his method of treatment? So you will get these long sort of footnotes in Organon of Medicine at different places. Okay, this is one of the such place. Now go to aphorism number 75.
These inroads on human health effected by the allopathic non-healing art, more particularly in recent times, are of all chronic diseases the most deplorable, the most incurable, and I regret to add that it is apparently impossible to discover or to hit upon any remedies for their cure when they have reached any considerable height.
Underline most deplorable, underline most incurable, most deplorable, most incurable. Okay, when they reach any considerable height, it is impossible to cure. If it is like atrophic rhinitis produced by atropine drops, it is impossible to recover it. Gone, the mucosa have gone. Okay, there is no chance of recovering it. Eyesight have gone, dullness is there is no chance of recovering it after it reach considerable height, because of the medicine. Okay, because of the medicine, the natural healing art is not possible. What is possible? Hahnemann is discussing it in aphorism number 76. What is possible?
Only for natural diseases has the beneficent deity granted us in homeopathy the means of affording relief, but those devastation and maimings of the human organism exteriorly and interiorly, affected by years frequently of the unsparing exercise of a false art, with its hurtful drug and treatment, must be remedied by the vital force itself.
Underline this.
Appropriate
Must be remedied by vital force itself. Must be remedied by the vital force itself. Underline this. Maimings means injury. Maimings means old English injury or some damage to the part, permanent damage. Okay, underline must be remedied by vital force itself. And you ask a question, Sunil, in last class, that
yes,
what is repellent and what
yes,
is this. These are also old literature and old medical terms. Okay.
yes. So, sir, what is the meaning of repercuents and
That was some sort of medicine which was being used at that time with particular
okay,
purpose. Okay, old medical terminology,
yes,
old English. Okay, that was some medicine for particular purpose. These are old medical literature. Exact meaning is,
yes,
but I haven't found exact meaning, but these are present in old medical literatures. Okay,
yes, sir.
sort of like means previously used medicine which are not being used nowadays. Okay, with particular purpose, like tonic. In tonic there are different constituent. This medicine is doing, adjuvant is doing this kind of thing. This chief ingredient is doing this kind of thing, like that. Okay, so with a particular purpose they were using these those medicines, named medicines. Okay,
Yes,
so here maiming is an old English term, maiming, which means injury or damage, permanent injury or damage. Now, must be remedied by vital force itself. Underline that.
shall I
Now,
read, sir?
read the bracket.
Okay. Appropriate aid being given for the eradication of any chronic miasm that may happen to be lurking in the background.
Hmm.
If it has not
Appropriate,
already
this
been
should
too
be given. Appropriate aid should be given if the miasm is behind. This is the possible way you can help your patient. Okay. Now,
sir, but here there is miasm or some artificial miasm.
no, miasm. If the miasm is lurking behind, not artificial miasm, chronic miasm. There is artificial disease, but along with this, if the miasm is there, you can give help. ओके, क्रॉनिक माइजम इज लर्किंग, लर्किंग मीन्स छुपा हुआ है. अगर क्रॉनिक माइजम भी है, जैसे कि हम लोग मास्क वेनिरियल डिजीज में देखे थे, मर्क्यूरियल डिजीज एंड द क्रॉनिक माइजम वाज व्हाट, सोरा एंड साइकोसिस, सोरा एंड सिफिलिस वाज देयर. तो तुम तो मर्क्यूरियल डिजीज को नहीं क्योर कर पा रहे हो, आर्टिफिशियल डिजीज है, एंड देयर इज सोरा एंड सिफिलिस. तो एप्रोप्रिएट एड इज गिविंग टू एनी माइजम लर्किंग बिहाइंड. ओके, लर्किंग मीन्स छुपा हुआ पीछे.
तो सर तो जैसे मतलब these diseases produced due to some constant use of drugs, so I think इधर तो कोई miasm है ही नहीं, क्योंकि ऑलरेडी एक persistent यूज कर रहे हैं वायलेंट हेरोइक मेडिसिन. जब आर्टिफिशियल डिजीज
if any appropriate aid being given for the eradication of any chronic miasm that may happen to be lurking behind. If, okay, if there is any, you found an examination, there is this artificial disease and there is a miasm also, so you cannot cure artificial disease, but appropriate aid can be given to that chronic miasm. Got it?
Yes, sir.
Okay, thank you.
If
Next.
it has not already been too much weakened by such mischievous act, and can devote several years to this huge operation undisturbed, a human
Underline
healing
this,
art for the
underline this whole line. Now I am reading just underlined line. Must be remedied by vital force itself if it has not already been too much weakened, and can devote several years to this operation undisturbed. I'm reading again. Must be remedied by vital force itself. If it has not already been much weakened, and can devote several years to this operation undisturbed. Okay. Now, last sentence of this, a human healing art for the restoration or normal state of these innumerable abnormal conditions so often produced by allopathic non-healing art, there is not and cannot be. Okay. So, how to treat artificial chronic diseases? It should be remedied by vital force itself. Okay. If any miasm is lurking behind, a proper aid given to that and should be left to vital force itself. But nowadays, what we have already told that there are some medicines which we can use for the abuse of particular allopathic medicines. Okay, like steroid, like aspirin, like insulin, like vitamin D. You will surprised to know that we have vitamin D in potentized form. We have many vaccines in potentized form. What is happening in DPT vaccination? In DPT vaccination, there is pertussis, which is causing, you will read that vaccine damage children by Harris Coulter, especially those who are in their MD. You can go through that book, and DPT, that pertussis is causing the nervous affection of child, and you will read in your PSM that what this DPT, bad effect of adverse effect of DPT vaccination is nervous affection of the child. And we have, you will be surprised to know that we have DPT as potentized form and it is working. Okay, I have happened to use it in 2 or 3 cases where the DPT after DPT vaccination, the child didn't stop crying. Okay, so I have given DPT is available in at least in this LM potency. There is a pharmacy in Kolkata, a national international homeo pharmacy, where this DPT is available in LM potency that I have given. Okay, according to here, aphorism number 76, a human healing art is not possible, but that was limited to the period of Hahnemann. You have to discover every way to help out your patient. Okay, so these are the methods you can, advanced method you can use these medicines to help out your patient out of these damaged already have been done. Okay, so in that case, DPT was very good, very helpful medicine. DPT, you will get the reference of this DPT in Lotus Materia Medica also. Okay, but only use I know of this DPT. People are using DPT and other medicines on the constitutional basis also. Sulfonamide. Okay, these are now people are using. Sulfonamide is a medicine previously used for typhoid and constituent of many modern drugs. Okay, and people are using these as what to say, polycrest medicines. But I don't know those uses. Maybe in future it may develop in as a polycrest medicine, but as of now I know only one use of this DPT to antidote the bad effect of DPT vaccines. Okay, usually this pertussis P of this DPT is causing the damage, and you will read that in DPT in PSM you will read those children having nervous affections will be given only D and T, diphtheria and tetanus, not pertussis, not pertussis. Okay, so this was at the time of Hahnemann that the vital force should be remedied by itself, but now we know some aid to these also we can give. Okay, now come to aphorism number 77. This is all about pseudochronic disease. I don't know actually who coined the term pseudochronic disease. Okay, I tried to find out but didn't get that who coined the term pseudochronic disease. But the Hahnemannian term for this is inappropriately named chronic disease. These are not chronic disease but inappropriately named. Okay, if you happen to sit on the viva table in front of your examiner, an orthodox Organon examiner will like to hear the term inappropriately named chronic disease, not the pseudochronic disease. Though pseudochronic disease is easy to pronounce, easy to utter, but the orthodox Organon examiner will not be happy until and unless you are telling this is inappropriately named chronic disease. So this you should remember, be in your MD viva or your undergraduate exam, undergraduate viva. This is for the academic purpose, but whatever you will say, it will meaning by the same. Pseudochronic disease, inappropriately named chronic disease, both are same. Okay, just read this.
Those diseases are inappropriately named chronic, which persons incur who expose themselves continually to avoidable noxious influences,
Underline
who
this.
are in the habit of indulging
Expose themselves continually to avoidable noxious influences. Avoidable. What kind of noxious influences these are? Avoidable. Okay, underline this. Themselves continually to avoidable noxious influences. Okay, inappropriate named chronic disease. Next.
who are in the habit of indulging in injurious liquor or ailments, are addicted to dissipation of many kinds, which undermine the health, who
What is
undergo
dissipation?
prolonged
What is dissipation?
dissipation means some kind of sexual activity or indulging.
Excessive high class of lifestyle. Excessive indulgence in alcohol and sex. Okay, you can term it a kind of high class lifestyle. Okay.
Sedentary lifestyle.
Excessive lifestyle having overindulgence in alcohol and sexual functions.
So are addicted to dissipation of many kinds, which undermine the health, who undergo prolonged abstinence from things that are necessary for support of life, who reside in unhealthy localities, especially marshy districts, who are housed in cellars or other confined dwellings, who are deprived of exercise or of open air, who ruin their health by overexertion of mind or body, who live in a constant state of worry, etc. These states
Underline.
of ill health
Stop here. Stop here. How many? Just give Roman 1, injurious liquor or ailment. Roman 1. Roman 2, addicted to dissipation. Roman 3, undergone long absences from the life. Okay. Roman 4, resides in unhealthy localities, marshy districts. Roman 5, housed in cellar or confined dwellings. Roman 6, deprive exercise or open air. Roman 7, ruin their health by overexertion of mind and body. And Roman 8, constant state of worry and etc. All these are accessory circumstances. Okay, uh, these have a influence on his health. Okay, if he is not having his diet properly, if he is not having exercise, if he is not having access to open air, all these are causing a certain illness on the body and mind of the patient, which can the patient can recover from these under the improved condition of living. Okay, which patient can get back under the improved condition of living. But what if these accessory symptoms have initiated? These accessory symptoms have initiated the chain. Okay, Sora was there, and these accessory circumstances have pinned that. There was a sudden grief. Okay, and we know that grief is the chief element which poke that Sora to rise up. Okay, then again, those removal of those will not cure the disease. Okay, if these accessory circumstances have caused a initiation of chain of event, then removal of those diseases will not, those circumstances will not cause the cure. There again, you have to treat the miasm under the improved condition of living also. Okay, under the improved condition, even if the person have left that place, but still the disease is there, then you have to remedy for the miasm. Read the next line.
These states of ill health which persons bring upon themselves disappear spontaneously provided no chronic miasm lurks in the body under an improved mode of living, and they cannot be called chronic diseases.
One of the most important line here is provided no chronic miasm lurk behind. Provided no chronic miasm lurks behind. Okay, if there is no chronic miasm, the improved condition of living will be enough. Okay, if there is chronic miasm behind, you need a miasmatic treatment. From here onward, 78, 79, 80, 81 and 82, discussion on chronic diseases. Okay, these are the discussion on chronic diseases. Natural, what kind of chronic disease? Natural chronic disease. Okay, so just go on. 78, go to content and see.
The
Go to content and see.
um, 78.
78, what
Chronic
is written?
diseases. Chronic diseases proper. They all arise from chronic miasm.
Okay, chronic disease proper. Other name for natural chronic diseases are chronic diseases proper. Okay, these are actual or true natural chronic diseases. Okay, number 79, syphilis and psychosis have been discussed. 79, syphilis and psychosis have been discussed.
Yes.
80 and 81, 80 and 81. See, Sora. It is the mother of all true chronic diseases except the syphilitic and psychotic. Okay, here it is written, but it has not been mentioned there. Okay, we will discuss this point. Except the syphilitic and psychotic. But Kent is saying that Sora is, if Sora is not there, syphilis and psychosis would not have been there. This is Kent's opinion. Sora and syphilis is the mother of, Sora is the mother of all chronic diseases except syphilis and psychosis. This is Hahnemann's opinion. Okay, but Kent is saying Sora is necessary for development of syphilis and psychosis. If Sora is not there, syphilis and psychosis would not have been there. Okay, this is Kent's opinion. You need to know the both. Okay, so underline this, except syphilis and psychosis. 82. Here 82 you will get, among the more specific remedies discovered for the disease chronic miasm, especially for Sora, the selection of those for the cure each individual case of chronic diseases is to be conducted all more carefully. Here it is the linking aphorism. From 83 onward, what is going to start? What is going to be started? Case taking. So 82 is the linking aphorism between these. The knowledge of disease in general, knowledge of disease in particular. Okay. So go to 78. Go to 78. What is there? Chronic disease proper started and discussion on that. And 79, syphilis and psychosis. 80, there are primary manifestations given. 81, 80 and 80, 80 and 81, primary manifestation of psychosis and syphilis is given also, and of Sora. And discussion of Sora started from here. Okay, so read 78.
The true natural chronic diseases are those that arise from a chronic miasm.
Underline true natural chronic diseases. Underline true natural chronic diseases, and we have read chronic disease proper. Both are same. Examiner will be pleased if you mention both in your theory paper. This is written in content. This is here. This is for undergraduate people. Okay. Read.
Which, when left to themselves and unchecked by the employment of those remedies that are specific for them, always go on increasing and growing worse, notwithstanding
Underline
the
this.
best mental and corporeal regimen.
Always go on increasing and growing worse.
Okay. Worse, notwithstanding the best mental and corporeal regimen, and torment the patient to the end of his life with ever aggravated sufferings. These are the most numerous and greatest scourge of human race. For the most robust constitution, the best regulated mode of living, and most vigorous energy of the vital force are insufficient for their eradication.
Okay, underline this. Most robust constitution say last step. These are most numerous and greatest scourges. In 6th edition, Hahnemann have given except those produced by malpractice, allopathic malpractices. Okay, that is in the 6th edition. That artificial chronic diseases you will find more and more. Even today, you will find more and more than the proper chronic diseases. Okay, even if the regime is good, diet is good, all things are good. Even these are maintained. Aphorism number 77 is not applicable here, but still the if once infected, the patient will grow worse and worse with the time. Okay. Now read the footnote. We have referred somewhere to the footnote. Why it is the child born with the miasm, but it is during the flourishing years of youth, it has not been discovered. Okay, but जैसे जैसे उम्र जा रही है, with the time the person is getting old, the frame, the body, his body is getting old. This body will be overcome by those diseases. Read the footnote. We have already mentioned it, referred it. Again, read it, please.
During the flourishing year of youth and with the commencement of regular menstruation joined to a made of life beneficial to soul, heart and body, they remain unrecognized for a year. Those
What are they?
afflicted
What
appear
are
in
they?
perfect health.
What are they?
पेशेंट के लिए बात हो रहा है.
No, a chronic miasm के लिए बोला है. For the chronic miasm remain unrecognized. लिख लीजिए वहां. Please read there. Please write there. Chronic miasm. Now read. Chronic miasm remain unrecognized. When? During the flourishing years of youth. Okay?
Those afflicted appear in perfect health to their relative and acquaintances, and the disease that was received by infection or inheritance seems to have wholly disappeared.
Infection or inheritance. This is the inheritance of at one place I have found. Only at one place I have found this. Infection or inheritance. Hahnemann is talking about inheritance. Okay, disease are coming from parents. Okay, miasms are coming from parents. In Organon, only at one place, this place, I have found this inheritance of disease. Infection or inheritance. Infection means during the lifetime patient has acquired. Inheritance means from the parents. It's coming from the parents. And Kent's attitude towards this inheritance is that in the stage in which the disease is, it will be transferred to the parent. It will not be transformed in the primary stage. But the parent was suffering from the secondary stage. The child will be suffering from secondary stage. Okay, and that is what somewhat this is somewhat a correct process of thinking, that the miasm is being transferred in the stage in which it was. Okay.
But in later year, after adverse event and conditions of life, they are sure to appear anew and develop the more rapidly and assume a more serious character in proportion as the vital principle has become disturbed by
Underline
debilitating
this.
passions.
Proportion to the vital force has become disturbed. Proportion, the vital force has become disturbed in the later adverse events of life. During with the adverse event of life, और उसको ले नहीं पा रहा. These events cannot take.
In proportion as the vital principle has become,
especially when disordered by inappropriate medicinal treatment. Okay, so this footnote is important in the view of miasm. Why miasms are not being discovered? Why miasms are not being recognized in the youth or regular commencement of menstruation? Because the frame is too strong to hold, those giants inside. But as the later years and debilitating passion, all accessory circumstances are contributing, and these diseases are now developed. Okay, clear?
yes.
Okay, go to 79. 79 is discussing psychosis and syphilis. These 78 was general discussion. 78 was general discussion on chronic disease proper. Now 79.
Hitherto, syphilis alone has been to some extent known as such a chronic miasmatic disease, which when uncured ceases only with the termination of life. Psychosis, the condylomatous disease equally ineradicable by the vital force without proper medicinal treatment, was not recognized as a chronic miasmatic disease of a peculiar character, which it nevertheless undoubtedly is, and physicians imagined they had cured it when they had destroyed the growth upon the skin, but the persisting dyscrasia occasioned by it escaped their observation.
Okay, dyscrasia occasioned by it. Underline this. Persisting dyscrasia. Okay. Why Hahnemann is telling this? Hepatosyphilis alone has, to some extent, known as such a chronic miasmatic disease. Okay. During the time of Hahnemann, John Hunter was a physician who worked a lot on Hunter. Have you heard of Hunterian chancres? John Hunter. Okay, Hunter was a physician who have worked a lot on syphilis. Okay, and he recognized the chronic effect of syphilis. That once syphilis have infected a person, there are constitutional effect of this syphilis. No, this is not a local disease. He recognized that this is not a local disease. It is causing the insane paralysis. It is causing the foot ulcers. It is causing the ophthalmia. It is causing certain diseases in the whole constitution of the body. So syphilis is not a local disease. It is a chronic constitutional disease recognized before Hahnemann also. That this syphilis can be transferred to the next generation. Have you heard about Hutchinson's teeth? Okay, cleft palate, cleft lip. All these are the signs of inherited syphilis. Okay, the Hutchinson's teeth, serrated teeth. Okay. So these were discovered before Hahnemann, and they recognized the constitutional effect of syphilis. Clear? So Hahnemann is telling this was hepatosyphilis alone has been termed as miasmatic chronic diseases. But psychosis, this is the discovery of Hahnemann himself. That Hahnemann told that like syphilis, psychosis is also a constitutional disease, but it is escaping your observation. Like syphilis, you have discovered syphilis, a constitutional effect, but you are just these persisting dyscrasia occasioned by this psychosis is skipping your attention. But I have discovered, and this is also a constitutional miasmatic disease. Clear? So psychosis was discovery of Hahnemann. Like John Hunter have worked a lot on this on syphilis. Hahnemann have worked on psychosis. Okay, clear? Now next. Okay, a new topic will be started. Okay, a new topic will be started from here. That is Sora and its primary manifestation. We will deal it tomorrow. Okay, we will start it tomorrow. And here from here, if we will like, we will go to the Roberts chronic miasm. We will read chronic miasm from Roberts. So from next class onward, have chronic miasm of Robert with you. Okay, we will read from there. This is the best place to switch over to Roberts philosophy. Okay. Any question you are having?
Sir, I have a question, but out of context to Organon.
Okay.
But it is related to the chronic disease.
Okay. Ask,
please. I have already said that paragraph.
Which paragraph? Oh, in WhatsApp you have asked, no? So I have told you.
Yes, sir. No, sir. जो सर वो पैरा तो ठीक है, जो मैंने पहले आपको एक सेंड किया था पूरा उसका फोटो, उसका मेरे को एक्सप्लेनेशन.
Your question related to that para. What was that? I didn't get your question.
Okay, sir. पर
what was your question? You shared the para. You shared the para. I read it. But what was your question?
सर इन्होंने जो डॉक्टर हैनीमैन ने कुछ स्पेसिफिक मेडिसिन को ही उन्होंने एंटीसोरिक क्यों बोला है, क्योंकि हमारे पास तो नंबर ऑफ मेडिसिन बहुत है 4000 और 5000, लेकिन उन्होंने कुछ ही मेडिसिन के एग्जाम्पल देके ही बताया कि यही मेडिसिन है जो एंटीसोरिक हैं।
So this was during the time of Hahnemann discovered these medicines were discovered. How many medicines Hahnemann have used? Okay, 99 और 100 इसी में से ना बोलना है, बाहर से कहाँ से
यस,
बोलेंगे? 500 मेडिसिन तो उस वक्त नहीं थी ना उनके पास।
नहीं
Bills
कुछ
was
रेयर
the medicine.
मेडिसिन भी थी।
क्या थी रेयर
यस,
मेडिसिन बोलो?
तो कुछ ऐसे मेडिसिन जिनके कुछ स्पेसिफिक एक्शंस थे पर्टिकुलर ऑर्गन्स पर, लेकिन उनको उन्होंने एंटीसोरिक नेम नहीं दिया। लेकिन बहुत सारी जो पॉलीक्रेस्ट है सिर्फ उन्हीं को ही उन्होंने एंटीसोरिक बोला। सर मैं एक बार ये पैरा रीड करता हूँ।
ओके ठीक है ठीक है, एक बार ये पैरा हम भेज देना फिर से, ठीक है? पेज नंबर बोलना
यस,
अपने इस बुक का पेज नंबर बोलना, ठीक है? आई विल रीड
144।
इट 144, ठीक। द मेडिसिन्स नो?
यस सर,
ओके ओके ओके। लाइक बेलाडोना को क्यों नहीं बोला, एकोनाइट को क्यों नहीं बोला, ये ना
यस सर।
हमारा क्वेश्चन ये होगा,
वो तो
बेलाडोना को
सर
एंटीसोरिक क्यों नहीं
उन्होंने
बोला?
सर उन्होंने जो प्रूविंग किया है मेडिसिन का, जो उन्होंने इफिकेसी देखी एक पर्टिकुलर मेडिसिन का एक पर्टिकुलर डिजीज में। जैसे उन्होंने एक एग्जांपल दिया, द एफिकेसी ऑफ द हर्ब लाइकोपोडियम मच प्रेज्ड इन पोलैंड फॉर द प्लीका पोलिनका pointed me to the use of the pollen of lycopodium similar soric ailments.
Okay, Plica polynica is a symptom of sora, is it not?
Yes.
Plica polonica is a symptom of sora. If you have Robert, you will go to sora, chapter sora, and you get dry lustrous hairs which is tangling in it. Okay, that is a symptom of sora, and it is being found in lycopodium. That is why lycopodium, he is telling that this is pointed out my use of lycopodium in antisoric ailments.
Yeah.
He
And
proved the
another
medicine.
example.
He proved the medicines, got the symptoms, and he studied the sora. Okay, and those medicines which are matching with the symptoms of sora, he is telling antisoric medicine.
Yes sir. And sir, another जो example दिया है, the circumstances that some hemorrhages have been arrested by large dosage of salt was another hint. So was the usefulness of the Goicum, Sarsaparilla and Margarium even in ancient time, where venereal diseases could not be healed by any amount of mercury unless one or the other of these herbs had first removed the sora complicated with it.
Okay. Okay. Next. So what is your question?
ये सर जो ऑलरेडी हम मतलब ट्रीटमेंट पहले भी हम मरकरी से ही करते थे, बट इन्होंने कहा है कि जैसे गोइकम और सरसापारेला है,
पहले हम लोग
मेन
से
उनका
करते थे
प्रॉपर
ना?
ट्रीटमेंट जो मरकरी। यस सर।
हाँ, और hint was given by use of these hemorrhages, is it not? In previous literature found that Goacum and Sarsaparilla, people were using Goacum and Sarsaparilla and Mesothelium.
Yes.
Along with mercury.
सर सिंगल मरकरी से ये पॉसिबल नहीं है कि हम इसके बैड इफेक्ट को या जो भी सोरिक टेंट है उसको हटाया जा सके, या फिर सिफिलिटिक टेंट है, क्योंकि उन्होंने बताया कि गोइकम और सरसापारेला उधर पे।
मरकरी तो एंटीसिफिलिटिक है ना?
यस सर।
सोरिक के लिए तुमको एक और एंटीसोरिक मेडिसिन देना पड़ेगा। सोरिक के लिए तुमको एक एंटीसोरिक मेडिसिन देना पड़ेगा, जैसे go to aphorism number, if I remember correctly, wait, I will tell. Go to aphorism number 232. Aphorism number 232. Read it.
232 sir. These later alternating diseases are also very numerous, but all belong to the class of chronic diseases. They are generally a manifestation of developed sura alone, sometimes but seldom complicated with a syphilitic miasm, and therefore, in the former case, may be cured by antisuric medicine. In the latter, however, in alternation with antisyphilitic, as taught in my work on the chronic diseases.
Clear हुआ?
Yes,
Is it
sir.
clear now? Got it. So now one more aphorism I want to refer here. Go to, I think, wait a minute. Succession of antisuric medicines are needed, where Hanuman is telling 171.
So, this is in non-venereal chronic disease, those most commonly therefore that arise from sora, we often require in order to effect a cure to give several antisoric remedies in succession, every successive one being homeopathically chosen, in consonance with the group of symptoms remaining after.
Okay, so in cases of
Correct.
sora, you will need antisoric medicines in succession. Okay, but syphilis and psychosis are easier to treat than sora. Okay, in syphilis and psychosis, you may need one or two medicines if it is not complicated with sora. But in cases of sora, even if it is alone, you will need successions of medicine because it is a huge malady. Syphilis and psychosis, with their primary manifestations, are easier to treat. But if it is complicated with sora, then you will need those antipsychotic, antisyphilitic, antisoric, these medicines in alternation. Clear?
Yes, sir. सर और एक जो इसमें रेपिटेशन ऑफ मेडिसिन के बारे में जो सर डॉक्टर हैनीमैन ने एक पैरा में लिखा है कि हमें डोज को कम करते चले जाना है, बट हम तो नहीं करते हैं कम, जस्ट हम या तो उसको क्या करते हैं उसके ड्यूरेशन को बढ़ा देते हैं, लेकिन पोटेंसी को कम तो नहीं करते हैं. लेकिन जैसे हैनीमैन ने इधर बोला है कि अगर वो 30 पोटेंसी ले रहा है देन उसके बाद हमें 24 कर देना है, 20 कर देना है, फिर 16 कर देना है.
कहाँ बोला है बताओ?
प्रेजेंट ये सिर्फ इससे फार्मेसी पार्ट में बोला है, क्रॉनिक डिजीज में.
क्रॉनिक डिजीज में?
यस सर.
क्रॉनिक डिजीज में फार्मेसी पार्ट
156 पैरा लास्ट पैरा है.
Okay, at one place, no? At several places, yes. Hahnemann have mentioned this. Read the Duggan's appendix to 246. You will get an idea. I will refer it to again when we are discussing the posology. As you are you are interested in all these studies in depth, just read 246 aphorism and Duggan's appendix to that. And in this book, Pharmacodynamics, if you have this book, Pharmacodynamics by Hughes, okay, Pharmacodynamics by Hughes, read the chapter of appendix, last chapter here, appendix.
This I don't have this book, sir.
This you will get on PDF form. Okay, Hahnemann's doses. Okay, you will have an understanding of it. You will have an understanding with it, and see what our mode of study was according to era. In this era, what Hahnemann was using. In this era, what Hahnemann was using. In 1810, where Hahnemann was and what he was using. In 1814, like this. Okay, it is a quite interesting chapter. You read this. You will get it on internet PDF. If you won't get, I will provide it in group. Okay, I will try to provide it in group. And next, read the 246 appendix of Duggan. Okay, and you will get an idea of that, and we will discuss this posology chapter when we will reach there. Okay. You have asked you have asked really very good question that why it was there, and sometime actually in actual practice we need to go down. Okay, because the vitalities started to appear at the low frequency, so we have to go down. Read Stuart Close posology, and you will get there that digitalis was not curing with the higher and higher. I have told you in the group, I think. Sorry, in the WhatsApp message you have asked me. I've told you to
Yes, sir.
uh,
But
digitalization
is there any
incident.
importance of writing present scenario और present perception? क्योंकि आज के
Yes,
टाइम में
that
तो हम नहीं करते हैं ऐसा.
क्यों नहीं करते हैं? कर सकते हैं. हम तो जाते हैं 30 से 6 में जाते हैं हम, 200 से 30 में जाते हैं. But these are exceptions. Okay, and exceptions don't make a rule.
Sir, why
These are exceptions.
patient improve कर
Rule
रहा
is
है?
there.
Yes.
इसको इजी कर दिया है. केंट, डॉक्टर जेटी केंट ने इसको बहुत इजी कर दिया है. ऑक्टेव, केंट ऑक्टेव जाएंगे 6, 12, 30. हम लोग वो भी नहीं यूज करते, हम लोग 30, 200 से यूज करते हैं, है ना. 6, 12, 30, 200, 1M, 10M, CM, MM. These are 8 potencies. Kent have standardized. Okay, तो केंट ने इजी कर दिया इसको. पहले 60 भी होता था, 18 भी होता था, 12 पोटेंसी अभी भी होता है, बट 500 पोटेंसी इज नॉट
सर, ये तो असेंडिंग पोटेंसी के बारे में बोला है उन्होंने, बट जब पेशेंट इंप्रूव कर रहा है वो डिसेंडिंग पोटेंसी के बारे में बोल रहे हैं डॉक्टर हैनीमैन.
इंप्रूव कर रहा है तो नहीं बोलेंगे, इंप्रूव कर रहा है तब बोले हैं. ओके, क्या लिखा है?
मैं आपको एक पैरा बोलता हूं. Now when the physician has in this way used the solution of the medicine that had been prepared, if the medicine continue useful, he will take 1 or 2 pellet of the same medicine in a lower potency. If before he had used the 30th dilution, he will now take 1 or 2 pellet of the 24th.
Okay.
And will make a solution in.
Okay. ओके, जब इंप्रूव कर रहा है तब नीचे जाने के लिए बोल रहे हैं. मे बी दिस वाज एक्सपेरिमेंटल. This was experimental. Hahnemann's posology have changed from this. Hahnemann's posology have changed from like that. Okay, from crude to LM. Okay, from 1790 to 1843. Okay, okay. How Hahnemann reached there? बीच में एक इंसिडेंट आता है 1797 का. क्या होता है 1797 में? Hahnemann encountered homeopathic aggravation with veratrum album. ओके, तो यहां से वो डोज को कम करने जाते हैं. तो ऑल द Hahnemann's journey of posology indicates with two things. I have already told you. He was trying to adjust this posology with two things in mind. Number one was reduce the homeopathic aggravation. Okay, and number two was rapid cure. Okay, he want a rapid cure, so he was experimenting with lot of thing. Okay, फोर्थ एडिशन में जहां बोलते हैं कि सॉलिड डोज वेट एंड वॉच मेथड यूज करना है, फिफ्थ एडिशन में बोलते हैं स्लोली प्रोग्रेसिव केसेस में यू कैन रिपीट अगेन एंड अगेन इन फ्रैक्शनल डोजेस. सिक्स्थ एडिशन में इवन इफ देयर इज एमुलेशन, striking emulation, you can repeat your medicine. Okay, this is the concept of Hahnemann's posology, which was ever evolving. Okay, so these may be at that time, discovery of that time. Chronic disease को फोर्थ एडिशन तक ही छपा है ना, मीन्स chronic disease तो फिफ्थ एडिशन तक ही छपा है. इसका फिर आगे फिफ्थ एडिशन ऑफ ऑर्गेनन के बाद सिक्स्थ एडिशन ऑफ ऑर्गेनन आया, मगर chronic disease का कोई एडिशन नहीं आया. मे बी आगे आता तो ये सारी चीजें निकल जाती वहां से. ठीक है, तो दीज आर एक्सपेरिमेंटल, इवॉल्विंग, एवर इवॉल्विंग, चेंजिंग. एलएम पोटेंसी के आगे भी हैनीमैन एक पोटेंसी पे काम कर रहे थे. डॉक्टर पीटर मॉडल बोल रहे थे एक बार कि एलएम पोटेंसी से ऊपर भी एक क्यूब पोटेंसी पे हैनीमैन काम कर रहे थे. व्हाट वाज दैट? इट इज देयर इन केस बुक्स ऑफ हैनीमैन. पीटर मॉडल इज वर्किंग ऑन द केस बुक ऑफ टुडे ओनली. ही हैव मेल्ड मी अ recent article of him regarding case book, study of case book. All the case book he is studying so meticulously. So he was telling that in the case book we are finding a new potency, Q potency, which is more than that of LM potency. And how to prepare, what was that? No one knows. Okay, you cannot decipher from the case book. Hahnemann need to write a seventh edition for that, but it was not possible. So this was potency, concept of potency and doses was ever evolving. But whatever we know, 70% 70 to 80% केसेस उससे सॉल्व हो जाता है. 20% केसेस में हम लोग कहीं कहीं अटकते हैं जहां ऊपर नीचे करना पड़ता है. ठीक है, so it may be, you can say it was maybe experimenting to Hahnemann. Exception.
Yes,
okay.
okay.
ठीक है?
Thank you,
We will
sir,
meet
for
tomorrow and
clearing.
we'll start. Thank you to you.
Thank
We
you.
are learning a lot from you too. I'm learning a lot from you people. Okay, and those who are
Yes.
really wanting to be a homeopath, this subject is really very needful. Okay, otherwise there are full of physicians who are calling them homeopath but behaving like an cardiologist, gastrologist, like that. But society needs you as a homeopath, and this is not possible. Homeopathy is a specialization in itself, and this is not possible without the proper understanding and knowledge of homeopathic philosophy. That is what we are trying to do in these classes. Thank you.
Okay.
Thank you for giving your attention.
Thank
You're most
thank you.
welcome.